a 5-year-old boy is brought to the pediatrician's office by his parents after they noticed blood in his urine. The child has been complaining of lower abdominal pain and burning with urination. He seems to be more bloated than usual. Urinalysis shows a pH of 6.2, specific gravity of 1.010, glucose is negative, ketones negative, RBC is 1 to 2, WBC is 0 to 1, CAS 2 to 3. The pediatrician believes that the boy has bladder infection with a double-stranded DNA virus. Which of the following conditions is also commonly associated with this virus? So you need to identify what condition this child is suffering from, which virus can cause that, which double-stranded DNA virus can cause that. And once you get that, the next part of your answer becomes really simple. So is it gastroenteritis, a painful dermatomal vesicles, lymphadenopathy, a vesicular rash, or plantar warts? So this was it was tricky because it was a very layered question. It was, you need to figure out one thing in order to be able to figure out the next. So let's see what's going on here. The patient has hemorrhagic cystitis. So if you look at the urinalysis, you can see that there was some RBCs. So this patient has hemorrhagic cystitis, which is caused by infection with adenovirus. Adenovirus is one of the very few viruses which does cause hemorrhagic cystitis. And this is the most common condition associated with adenovirus. The most common condition associated with adenovirus is gastroenteritis. So speaking a little bit about adenovirus, it is a double-stranded DNA virus. It has many serotypes, 11 and 21 are the ones most commonly associated with cystitis. Other conditions are acute respiratory disease, the conjunctivitis, epidemic conjunctivitis, pharyngoconjunctival fever. It can spread through respiratory droplets, fecal-oral contamination, and direct contact. Okay, and the most common acute respiratory disease caused by adenovirus, these occur during spring and winter, are spread very easily in daycare centers due to respiratory droplet spread. Other infected population can include military recruits, college students, usually within dorms. A sore throat, cough, fever, rhinorrhea are the most common symptoms associated, and tracheobronchitis, bronchiolitis, and pneumonia are also associated with adenovirus. Acute hemorrhagic cystitis affects children primarily between 5 and 15 years of age. It has a predilection for boys more than girls. It is also observed in immunosuppressed patients. Dysuria, increased frequency, bladder fullness are commonly reported symptoms. Cross-bloody diarrhea occurs on rare occasions. The first symptom to subside in this case is hematuria, and it's a self-limiting condition. Patients are usually treated with just supportive measures. You don't need to do anything extraordinary to treat them. And infantile diarrhea is the most common GI infection reported with adenovirus. You can see breakouts in daycare centers. However, rotavirus is more likely than adenovirus if you see such a breakout. With respect to GI infection, 40 and 41 serotypes are most commonly associated, unlike 11 and 21, which were associated with hemorrhagic cystitis. And watery diarrhea usually subside in a few weeks. Complications like intussusception, mesenteric adenitis are very rare. Okay, so takeaway point here, adenovirus causes hemorrhagic cystitis. You have to remember this association because no other virus has that association. And adenovirus, along with causing hemorrhagic cystitis, can also cause gastroenteritis, conjunctivitis, and pharyngoconjunctival fever. These are the 3 important things that I would recommend remembering from this question.
Thanks for watching. Please give a thumbs up and subscribe for more.